Hi everyone, this is Helen. I hope you've had a good couple of weeks and everyone's staying warm. Um, my last 2 weeks I've had more home visits and they went fairly well. Um, One lady I went back to this week, whose husband had passed away in April, actually I'd gone to talk to her again about the coping with grief in the holidays, and she has already registered to attend that. So I was very pleased because I think she'll find it of a great benefit to her. Um, I also attended a day conference up in Raleigh, the capital, on frontotemporal degeneration. This is a dementia that affects people who are younger, um, around 50s and 60s. Um, there is no cure for it. There is nothing really apart from educating caregivers. So that is a very important aspect, that actually caregivers are educated in how to develop some strategies and techniques in caring for a patient with this um, form of dementia. It was an excellent conference. Doctors spoke, as well as family caregivers who were actually going through um, having to take care of somebody with this form of dementia. So the two breakout sessions I attended were one on behaviours, and that was excellent. The MSN who conducted that session brought to our attention something that I hadn't thought of but make perfect sense. That when somebody in their 80s um, has inappropriate behaviours or makes inappropriate comments, we tend to pass that off. Well, they've got dementia, and accept it. Somebody younger behaving in the same way, it's a whole different story. And so there is such a lot of education needs doing, for the public, to make them more aware of this dementia. The other breakout session I attended was a virtual dementia tour, which was excellent. And what they did was they gave you two insoles to put in your shoes, made of that plastic that you kind of put under computer chairs if they're resting on carpet, but you had to put them in your shoes with the raised area, the spiky bits next to your skin. I guess that was to kind of simulate neuropathy pain that a lot of elderly people suffer from. Then they gave you a pair of woolen gloves, a headset with an iPod that was playing constant voices, background noise, traffic noise. In you were hearing that the whole time, and a pair of dark glasses with like a pinhole for you to see through. You were led into an area, and you were given an instruction to do 5 tasks. You were not given any help, and you couldn't hear what was being said to you. So when they told me what the tasks were, all I could make out was fold, half fill. So when I was taken around the corner, I saw towels there, and I just started folding them. And when I looked to the side, there were some cups and a pitcher of water, and I half filled all the cups, and then stopped. And I said, I can't do any more because I don't know what the other tasks are. I couldn't tell what you were saying to me. So afterwards, in discussion with the lady, the I was talking to her about it and was saying what an excellent exercise it was, and it should be given to all caregivers, especially in long-term care. The company that were doing it actually do go around some of the nursing homes up in Raleigh. And when I spoke to my supervisor afterwards, she told me that she'd ordered the kit. So that was excellent. That exercise, it doesn't cost. Um, it doesn't take long to do, but it certainly has an impact. It really would engender more understanding and empathy for dementia patients. So I'm really glad that I chose to do that one. Tomorrow I do the support group on my own for the first time, um, and I'm looking forward to it. A little bit nervous, but I am looking forward to it. I really enjoy the support group. But there are a couple of people in the support group who like to talk. There are also a couple of people who do not say anything unless you directly ask them a question. So I was just going to throw out there for you this week and ask you what your experiences were with support groups where you had those who tend to dominate the group and those who do not say anything, don't contribute anything. Um, I know that they do attend, so obviously they must be getting something out of it. But maybe just some tips on how to draw people out a little bit. And I'd be interested to hear what you have to share about that. So I'd just like to wish everybody a happy Thanksgiving and enjoy the rest. And I look forward to hearing from you. Thank you.